Welcome back to What's Now. And once again, this episode is focusing on your health. And right now we are going to talk about lung cancer. Pro golfer Jason Day's mother was diagnosed with lung cancer, and he talks about the importance of biomarker testing with his mom. Let's take a look.
Today I have the opportunity to speak with professional golf champion Jason Day. He's on a mission to educate others about the importance of biomarker testing for lung cancer. And he is joined with Dr. Nicholas Rose, an oncologist and lung expert. And they are both going to discuss their perspective on this journey. Thank you, Jason and Dr. Rose, for joining us today.
Thank you.
Thank you for having us.
Oh, Jason, your mother was diagnosed with stage IV non-small cell lung cancer. Tell me more about this journey.
Yeah, I mean, stage IV non-small cell lung cancer, it sounds very, very scary. And it is scary. And a lot of people have it out there. For her to start her journey, along her journey in this process, we discovered biomarker testing. That gave her a complete diagnosis by identifying specific drivers that was causing her cancer to grow and spread. And we could get targeted therapy for her specific type of cancer. And, I guess, at the start of it, it was difficult for us because we didn't know what kind of options there were. And, I think the biggest thing for us was to keep asking questions and to communicate with the doctors. And we eventually came across biomarker testing. That's why I'm here today talking to you about this.
Now, Dr. Rose, lung cancer remains the leading cause of cancer death among men and women in the U.S., more than breast, prostate, and colon cancers combined. It's an incredible amount. So tell me more about the importance of biomarker testing.
Yeah, as you said, unfortunately, this is still a really devastating disease. But the really exciting thing being in the lung cancer field right now is we're changing the field so much and so quickly. And a really critical part of that is biomarker testing. So when you get your original lung cancer diagnosis, it's really important to advocate for you or your loved ones to complete that diagnosis, to get the biomarker testing, learn about the immune characteristics of your tumor, because not all lung cancers are the same. And we want to make sure that we personalize our care plan to each patient. So, while it's still a very deadly disease, we're changing that actively right now. So there's a lot of hope for lung cancer.
And Jason, your mom sacrificed so much to help you achieve your dreams, and then having to struggle with this diagnosis. Tell me a little bit more about that and how hard this has been for you and your family.
Well, it's been hard for me, but I couldn't imagine what my mom was thinking at the time when she realized that she has lung cancer and stage IV lung cancer. I'm sure that was very emotional, time for her. I know that it was stressful for me on the golf course, but I can't be thinking about myself. I got to be thinking about my mom and what we can do to best help her. And that's why I'm so proud to, and the partnership with AstraZeneca to talk about CompleteYourDiagnosis.com for anyone out there that needs to learn more about the biomarker testing that's going through stage IV non-small cell lung cancer. Not all cancers are the same, but to be able to get your complete diagnosis, go through the biomarker testing to really understand there may be an option there for you that can be targeted to your specific type of cancer. So, CompleteYourDiagnosis.com is the website you can go to and to learn more about the biomarker testing.
And Dr. Rose, this biomarker testing really helps to guide Jason's mom's treatment plan, which is how it plays such a big role because certain biomarkers can be the drivers that cause cancer to grow and spread. Tell me a little bit more about that.
Yeah, exactly. These biomarkers, lead us to these mutations that we occasionally call driver mutations because they can cause the tumor to grow. And by pairing these up with a targeted therapy, we're often able to block this pathway and stop these tumors from growing, potentially cause them to shrink down and really be able to get durable control of these tumors with really good quality of life. And, biomarkers, we can get this with the original tissue diagnosis for the lung cancer when we get that biopsy that gives you your initial diagnosis. But we're also able to look for this in the blood as well, something we call a liquid biopsy. So there's a couple different ways that we can find this information to personalize your treatment plan.
And Jason, how is your mom doing today? And tell me a little bit more about your decision to become such a big part of this Complete Your Diagnosis campaign and
Right.
donate so much time and effort to it.
Right. Yeah, and that's a great question. My mom is doing so much better. She's very active. She's picking up a bunch of hobbies. She's just picked up painting, which has been nice. I think through the personal struggles that she's had, and for me to experience that with her, it's become such an important part of my life to be able to get the message across to the lung cancer community to really understand that there are biomarker tests out there that you can take. CompleteYourDiagnosis.com once again is the website that I'm here to talk about. I know that people are going through some hard times right now, and I'm very blessed and thankful to have my mum with me here today, and I'm looking forward to spending a lot more time with her.
And it's really good to hear that she is doing so well. And Dr. Rose, treatment options for stage 4 lung cancer today include targeted therapy such as chemotherapy and immunotherapy, and really driven by these biomarkers.
So yeah, these biomarkers can help us get to a targeted therapy, and also by identifying these biomarkers, we can often avoid treatments that may not be as effective. Really, these targeted therapies are the first option for patients who have a driver mutation that has a paired pill. So we can really make sure that we're getting people to the right treatments and potentially avoiding the wrong treatments for them. So it is a critical part of our original diagnostic plan.
And Jason, you mentioned this website for Complete Your Diagnosis campaign. Anywhere else we should go to get more information, and how can we follow along with you in your journey?
Yeah, no, just CompleteYourDiagnosis.com is the website to understand and get more information about biomarker testing.
Perfect. Well, thank you so much, Jason, for sharing more about your personal journey and your mom. So glad she's doing better. And thanks, Dr. Rose, for giving us more important life-saving information about this biomarker testing with lung cancer.
Absolutely,
Thank you.
our pleasure.
Thanks for watching this episode of What's Now. Be sure to tune into Park City Television. You can find out more about our shows at parkcity.tv. You can also tune in live every day to Mountain Connections at 8 a.m. where we focus on the community. We like to inspire and inform our viewers. Thank you so much for watching. I'm your host, Christine Napier. We'll see you next time.